Hi everyone, I'm Carol Higgins and we're coming to you live from the Baptist Health Newsroom today. All month long we've been bringing you different stories about breast cancer as part of Breast Cancer Awareness Month. And today we have two topics for you. First, developing breast cancer as a woman under 40, and also the very fascinating topic of genetic testing and breast cancer. And we have two wonderful experts here to explain these things to us. First, Dr. Starr Mautner, who is a breast cancer surgeon at Miami Cancer Institute, and a breast cancer survivor, Rabbi Rachel Greengrass, and she's going to tell us a little bit about her journey through the cancer diagnosis and becoming a survivor. But before we start, thank you for being here, but before we start, I just need to take one moment to remind you all to submit your questions anytime during the program. We like this to be interactive, and we're going to take a few minutes at the end to do a Q&A, and our experts will answer as many questions as we have time for. So let's get started. Dr. Mautner, when we think about breast cancer, a lot of time we'll think about a woman who's older, definitely older than 40. Can you give me a feel for how many women are younger than 40 when they're first diagnosed?
So breast cancer is most commonly found in postmenopausal women. So you're correct. When we think breast cancer, we think of women who are older than 40. However, less than 10% of all new breast cancer diagnoses are found in women under the age of 40.
Wow, so that's a significant number. It's not the majority, but it's enough that people under 40, women under 40, have to be aware of it.
Correct.
And how old were you when you were diagnosed, Rabbi, and what led you to the diagnosis?
So I was 32 when I was diagnosed with breast cancer, and fortunately for me, but unfortunate in general, there were other young women who also were diagnosed around the same time. So I had a peer group to really help me through the process. I had my second son, and I was breastfeeding my second son. As we know, it's good for you and for the baby to breastfeed. And so I was touching my breasts a lot every day, and I found a lump. Of course, because I was breastfeeding, I at first thought that it was milk. But when it didn't really go away or change shape, I went to get it tested and really insisted that I knew it wasn't milk, and insisted on getting a biopsy and a mammogram.
And how was the reaction of the physician you saw at that time when you asked for that?
He said that it was really up to me, that I might want to wait a couple of months since my son was 10 months and my goal was to breastfeed for 12. But I'm really grateful that I didn't wait and that he supported me in that. Because as it turns out, it was breast cancer, and apparently the younger you are when you're diagnosed, the faster growing that cancer tends to be. So I'm very grateful that I didn't wait those 2 months.
So you were your own advocate in that case.
Yes, and it's very important, I think, for young women to be their own advocates and to insist on getting the screening that maybe isn't typically given to women in the under 40 group.
What do you see a lot of cases of women who discover it while, pregnant or after pregnancy?
So in women who are pregnant or just after pregnancy in the postpartum period, if they are going to develop a cancer, breast cancer is the most common cancer that is diagnosed. And there is a phenomenon known as breast cancer during pregnancy. And those cancers can act very aggressively, and they are commonly delayed in their diagnosis because, as Rabbi Greengrass was saying, when women are breastfeeding, their breasts are engorged and they're lumpy and bumpy and they have milk and they may develop mastitis. And it's very difficult to tell if a new mass is indeed a cancer. And so it's important that these women don't ignore these signs and that they're adequately worked up and not just dismissed because they have recently given birth. And in general, in women under 40, I would say in almost all cases that I've seen diagnosed, women are their own advocate, because oftentimes, because they are so young, doctors or friends or maybe the patient themselves could easily dismiss a lump and say this must be benign or it must be nothing. But I think it's really important to trust your own intuition and to know your own body and not ignore a sign like that, because as Rabbi Greengrass said, these cancers can act very aggressively. And while in general we may say that breast cancer grows slowly, if you do have an aggressive form of cancer, the difference between 1 and 2 months may actually make a real difference.
because the earlier detection is better. Speaking of early detection, the guidelines suggest women begin getting annual mammograms at 40. But for women who are younger than 40, what steps can they take to stay on top of their breast health?
So I always recommend that women understand their bodies and examine their own breasts, at least on a monthly basis. Even if it's not a formal clinical breast exam, just knowing their breasts, looking in the mirror every day when they get in the shower, lifting your arms above your head and then putting them on your hips, you look side to side for any asymmetry or dimpling that may occur. Most of the time when a breast cancer develops, it's asymptomatic and the patient wouldn't even know. However, sometimes there are subtle signs such as dimpling of the skin or subtle inversion of a nipple, and these are things that can be seen in the mirror. In addition, just feeling their own breast in the shower when lying down. And many patients have the misconception about clinical exams that they should pinch the breast tissue together to try to feel masses, and that's not the right way to perform a clinical breast exam. So you want to use the pads of your finger and actually examine with a flat surface. So you want to just go from up to down or around in a circular motion, making sure that you examine all of the breast tissue from the clavicle down to the inframammary fold and not pinch the tissue together, because if you do that, you're going to feel masses that are not real.
Not real, especially if you're post pregnancy and you're
in general.
breastfeeding. In general, you're going to feel it. Okay. Well, let's switch gears here for just a moment so we can talk about the genetics of cancer. I think we all remember in 2013 when actress Angelina Jolie made headlines because she came out and said she had a preventative double mastectomy because, in her words, she had a family history of breast cancer and also a faulty gene. Her words, which probably refers to the BRCA or BRCA gene that we talk about. She was just 37 when she came out with this public issue or a private issue and brought it to the public attention. And that really ignited public awareness and discussion about testing for genetic mutations. There's a lot of misconceptions about genetics and cancer. So if we could start with the most basic level, Dr. Mautner, what can you tell us about the role the genes that we were born with, that we inherited from our mom and dad, how do they affect our risk of developing cancer?
Sure. So we all have half of our genetic makeup from our mother and the other half from our father. And genetic mutations, not just those related to breast cancer, but any genetic mutations that form in an inherited way can be inherited from either the mother's side or the father's side. So one main misconception is regarding the inheritance pattern, and patients would say, well, my father's family history doesn't matter because I can only develop a breast cancer if I inherit something from my mother's side, and that's completely false. So when it comes to genetic mutations such as the BRCA gene, you can inherit it from either your mother or your father. Another misconception is that if you don't have a family history, you're not at risk. So we were talking about this the other day. Rabbi Greengrass doesn't have a particularly strong family history. It's not any reason to think that she would develop breast cancer at the age of 32. She didn't have any other young relatives. And so she can tell us, I guess, a little bit about what misconceptions maybe she has heard or maybe had herself prior to developing breast cancer, because most people who are diagnosed with breast cancer don't harbor a genetic mutation. Only about 10% of them do.
Yeah, thank you. So, yes, as Dr. Mautner shared, I didn't have a history of breast cancer in my family. However, I am an Ashkenazi Jew, and Ashkenazi Jews have a 1 in 40% chance of having either the BRCA1 or BRCA2 gene, whereas for the general public, it's 1 in 800. So as a rabbi, I really try and teach and advocate about BRCA and about getting tested in our community. However, I myself am not a BRCA carrier. As so far, right? Because we're always discovering things. So far, there isn't a genetic reason why or predisposition for myself to have developed breast cancer. And as Dr. Mautner said, for those who get tested and find out they have BRCA, it's really empowering because they have a choice, like Angelina Jolie did, to say, okay, I can get screened. They can get screened at a younger age. They can take care to check themselves well. And if they want to, they can have preemptive surgery or take medicines that
medications
will
to try
lower
to be
their
preventative.
chance. So I personally am now on tamoxifen, and this is a hormone repressor, and I know that there are women who take this, who do have a strong family history, who have not yet been diagnosed with breast or ovarian cancer.
But before you developed cancer, like you said, you didn't have a strong history, so you didn't feel like maybe you are someone who should go get tested.
No, I didn't. I actually, in my family, the women in my family, particularly on my mother's side, had cystic breasts, and each had found a lump at some point that had been removed that was completely benign.
Oh.
And so I had told my husband before we got married, one day I'm going to find a lump in my breast. Don't worry, it's not going to be cancer. But had I not had that history in my family, I think I might have thought that lump was milk and maybe not have been so persistent. And so again, just want to emphasize how important it is for women to be their own advocates and to check themselves. And Dr. Mautner talked about checking yourself with the pads of your fingers. It wasn't until I had breast cancer that I understood how different it feels than the normal lumps in your breast, especially when you're a young woman. We tend to have dense, lumpy breasts. It really feels like a BB or a marble. So.
What are, both of you are of Ashkenazi Jewish descent.
Yes.
Is that true of most Jewish people in the United States?
Yes, so the majority of Jews in the United States are of Ashkenazi Jewish descent, which means that they're from Eastern Europe.
Okay.
However, not being of Ashkenazi Jewish descent does not mean that you're not going to be a carrier of one of these genes, and it doesn't mean that you're not going to develop breast cancer, as 1 in 8 women in the United States develop breast cancer in their lifetime.
What are some of the other criteria for someone to be tested for the BRCA gene?
So if you do not yourself have breast cancer, there are a list of criteria to say whether or not you would qualify for genetic testing, and many of those criteria have to do with female relatives that have either developed breast or ovarian cancer in the family. So any person that has a relative with ovarian cancer actually qualifies for genetic testing, because ovarian cancer is extremely rare. And it's one of the things that is linked to a BRCA1 or BRCA2 mutation. And then there's other criteria, such as having a primary and secondary relative that developed breast cancer, especially at a premenopausal age. However, this criteria used to apply to patients who develop breast cancer themselves. We'd have to check off a list to make sure they met criteria to get genetic testing. And what we're learning more and more is that even in patients that don't meet the criteria but have breast cancer, 10% will actually have a genetic mutation when they go to get tested. And so that criteria for patients that have breast cancer is kind of out the window now. And we're seeing more and more expanded criteria for genetic testing for anyone that actually has a breast cancer could potentially qualify for testing.
And is genetic testing and counseling available at Miami Cancer Institute?
Absolutely. And so as genetic testing has become more popular and prevalent, many places do testing. And one thing to be aware of is when you have that testing done, there's not always counseling available. At Miami Cancer Institute, we do have genetic counselors, and it's very important, I think, to meet with a counselor before you embark on testing. The results of testing can have many implications, some of which you're not even aware of when you go for the testing. It may have implications in terms of obtaining life insurance, or what you're going to do with these results. At this point in time, there are things called variants of uncertain significance, which are not actual genetic mutations, and we're not sure what they mean. But if you are set up with a genetic counselor, as more information becomes available, those variants may be recategorized as mutations years down the road. And you want to be sure that you're at a place where you're actually going to be given that information if something were to change.
We have, billions of genes in our makeup, and we're talking about just a few here. But is the predisposition to breast cancer limited to that BRCA gene, or are there others that you test for?
So BRCA1 and BRCA2 are the most popular, and in part because of Angelina Jolie, everyone knows BRCA1 and BRCA2, but there are other genes that are less popular but still have to do with breast cancer risk. One of those is the CHEK2 mutation, the PALB2 mutation. And ATM mutation is another one that we test for. And so many times when patients think that they're going for BRCA genetic testing, they actually have a full panel test of over 30 genes to test for. And depending on the family history, they may qualify for other genes. And so these genetic mutations have to do with not only breast cancer, but could be endometrial cancer, colon cancer. You may find out that you have a mutation that has nothing to do with breast cancer. And the mutations really depend on family history, because the different mutations can refer a different type of prevalence of the cancer. So if you're someone where everyone in your family had ovarian cancer and you test positive for a BRCA mutation, we're actually a lot more worried about your risk of ovarian cancer than breast cancer, although you have to worry about breast cancer too. And so there's different penetrance even within the genetic mutations.
I can see why genetic counseling is so important, because that is a lot of heavy, thick information to try to get through. As a layperson, I don't know how one would do that. Let's talk a little bit about survivorship. Rabbi, how long have you been a survivor now, and what kind of things are you involved with as a survivor for other survivors and people going through diagnosis and treatment?
So I was diagnosed March 15th of 2013. So it's been over 6.5 years for me, and I'm grateful for all of those years. I turned 39 in April, and people were joking with me that I should say I was younger, and I said, no, the goal is to get older. So a few different things I think helped me in terms of my healing. One was finding other women who had gone through breast cancer who could really mentor me through the process. Because it's so prevalent in the Jewish community, we in fact have a Jewish network of breast cancer survivors called Starr, which Dr. Mautner is, they're having an event this week, which Dr. Mautner will be at. We also, a group of us, including a woman who was BRCA positive and ovarian cancer survivor, came together to talk about, well, what would really be healing for us. And we all talked about the excellent care that we received and wanted to make sure that other women had that opportunity. And so we started a rock and run, which was either dance or run a 5K in order to raise money and awareness for breast and ovarian cancer. And we've been very blessed that MCI has been a sponsor of that event, and it's really brought out a lot of people from Miami and spread awareness.
That's great. Yeah, I've met Amy Holub.
Yeah.
Terrific. And it's a great event that happens in September.
This year was
This
September.
year was,
October.
so because September's ovarian cancer,
Right.
October's breast,
Right.
we do
So
it
the pink
somewhere close to both.
Yeah, it works very well. What is this event that you're going to be a part of this week?
So on Wednesday night, Temple Bet Shirah is actually hosting a panel called What's Jewish about breast cancer. And so we're going to be talking a lot about genetic testing and new treatment options for patients that are BRCA mutation carriers. I will be on the panel along with Dr. Joseph Panoff and Dr. Kate Lampin-Sacker, and that's at 7:30 on Wednesday. And Starr Sherrod is involved in that, as well as Miami Cancer Institute.
Terrific. Getting that message out there. I know you're both very active in helping us get that message out to survivors. We do have a couple of questions that we're going to address. Thank you for sending them in. First, does genetic testing at home work, like 23andMe or Ancestry DNA?
So you have to be really careful with that at-home testing. While those tests are great to kind of give you an idea as to your ancestry, it does not test for all of the BRCA-related genes, and it can give someone a very false sense of security if they test negative for BRCA on 23andMe. I would not recommend 23andMe for a real full panel test to see what your risk of breast cancer is. For that, we offer several companies that we work with. And as I said, I would see a genetic counselor, but I would not rely on the tests of 23andMe to say I'm in the clear and I don't have a genetic mutation predisposing me to breast cancer.
Is that something you hear from patients who've come in and say, well, I'm confused because I did 23andMe and they said I'm
Sometimes, but
Yeah.
not as often as you would think. Maybe our genetic counselors may see it more, but I'm dealing a lot with patients who have recently been diagnosed with breast cancer, and I actually haven't heard it as much as you would think. Many patients come in and they haven't yet had genetic testing.
Okay. Here's another question. If you test positive for the BRCA mutation, are you 100% sure or certain to develop breast cancer?
So the answer to that is no, depending on which BRCA mutation you have. So there's BRCA1 and there's BRCA2. The BRCA1 mutation puts you at a higher increased incidence of breast cancer. Lifetime overall risk can reach 70%. BRCA2 lifetime overall risk can reach 50%, but it depends on a number of factors. One, the age at which you're diagnosed, because let's say you make it to age 80 and for whatever reason at age 80 you decide to do genetic testing and you find out that you're a BRCA mutation carrier. Well, you made it to age 80 without ever developing breast cancer, so the risk that you develop it within the next 10 to 20 years of your lifetime is relatively low. However, if you test positive at the age of 25 and you have your entire lifetime ahead of you, then that risk can really get up to 70%, and you need to decide if you're going to do advanced screening options versus prophylactic surgery at some point in time. The risk is not 100%, but we do look at the family history, and as I said, it's variable penetrance depending on the family history.
Okay. Well, we are starting to come to the end of our time, so I'd like to ask each of you to let me know a final thought that you'd like to leave for our viewers today. Rabbi?
Oh, great. I would just say, please be your own advocate, check yourself, make sure the women in your life check themselves. And also for those sisters who are part of this terrible club that's full of fabulous women, just remember who you are and that you're more than a patient, and don't lose yourself.
Very good.
I think that is unbelievable advice and very important advice. I also would say that since it is Breast Cancer Awareness Month, we talk a lot about mammograms. Mammograms are extremely important. We usually screen starting at age 40. So if you're under age 40 and you're not getting screening mammograms, but you feel something, as we said, please do not ignore it. Even if a physician tells you you're under 40 and you don't need a mammogram and that this is nothing, I unfortunately have seen a number of patients that came to me with that same story and ended up developing or having a breast cancer at that point in time, and they were their own advocate. So be your own advocate, be persistent. If there is something that you feel it just isn't right, have it worked up and have it biopsied if it needs to be.
Very good. Great information today. Thank you so much for being here.
Thank you.
Thank you for having us.
Terrific. And thank you for our viewers. Before we let you go, I want to remind you to please follow us on social media. You're going to see on the screen our handles for Facebook and Instagram and Twitter and LinkedIn. And you can find them on our website, baptisthealth.net. Please remember to give us a try, because you're going to see information about upcoming Baptist Health events and as well as the latest health information. So on behalf of all of us at Baptist Health, I'm Carol Higgins. Thanks for watching today, and we'll see you next time.